I can imagine a day that people don't have to suffer from MS.
I can imagine a day when we can treat it even before it manifests itself.
Imagine a day when you could go to the physician and there were many options available that were not including an addictive medication.
Imagine a world without PTSD.
Imagine a world where someone who is paralyzed does not have to be paralyzed.
The front passenger tire blew out, and that's when the vehicle began to roll, and it threw me out the driver's side window.
A devastating car crash left him a quadriplegic.
When this first happened, I was told, lock those doors and throw away the key.
This is a paradigm shift.
One of the first few in the country to take part in the Asterias Biotherapeutics clinical trial.
He was only the second to receive these stem cells.
It's a miracle. That's the only way to describe it, is it's a miracle.
Without research, it's just not possible to do work like this. It's an absolutely critical part of being able to offer new treatments that sort of break the mold. Things that are completely innovative, that change the paradigm, that are out of the box. You really need seed funding so you can prove that the idea has substance. 15 years ago, stem cell research for spinal cord injury represented such an out-of-the-box idea. Without that seed money, Lucas's treatment would not have been possible.
1 in 5 people will develop PTSD after experiencing a traumatic event that they need medical care for. It's a significant health disparity. We have folks that are coming from environments where most of us wouldn't want to be living, and under stressful circumstances that most of us would never experience in our lives. We need to care for those individuals in a way that gets them maybe to even a better place than they were before after a traumatic event. You can have 2 people go through seemingly similar traumatic events, and one person can be completely fine, and another person have really high symptoms of distress. So what we're trying to do is really understand neurobiologically what factors influence the development of PTSD. We can develop targeted interventions so that we can hopefully prevent a chronic PTSD course for some of our patients.
I got diagnosed May 27th of 2015.
Research leads to insights that ultimately, as a physician, will help folks.
I used to give blood every 8 weeks. It was my thing. I had blood drives. It was just my thing since I was younger, and after my diagnosis, I couldn't do that anymore. In my eyes, I almost felt a little relieved because I knew what it was, and I knew there were treatments out there for it.
When I started, we had no therapies. Now we have 15 therapies, so there's been a big impact. Having an instrument such as a 7 Tesla magnet will increase our ability to make the next step in therapeutic interventions.
They're getting closer and closer to finding a cure, and even if there isn't a cure but better treatment, it's very important.
The opioid epidemic is actually one of our larger health care and health policy epidemics. The challenge is figuring out what works over the long term. We are taking the records of every patient within a hospital system, and we are looking at everyone that has received an opioid prescription and then follow within the medical record how they are functioning. Are they getting better or are they getting worse? The opioid epidemic is something that's not going to be solved by physicians alone. It's not going to be solved by our government alone. One of the areas that it's going to solve is individual citizen action. We need people and time and someone to help.
Having private sources of income that give investigators latitude in what they want to look at and some flexibility is extremely important.
The small amount of pilot funding can translate into $1 million of research.
Some would say 99% of research doesn't result in a successful treatment. Only 1% does. If you didn't do it at all, you wouldn't get even the 1%.
Someone's got to do this, and people who don't volunteer, well, then we'll never know.
Every phenomenal success in my mind starts from hope, and I think Lucas is a clear example of that.
Getting that strength to do the things that you always could do, it's awesome.
Hope is the seed with which you can imagine bigger things.